Afternoon, everyone. My name is Shari Bolen. I am a general internal medicine physician and professor of medicine at the Metro Health System and Case Western Reserve University. I co-lead the Heart Healthy Ohio initiative, and Dr. Caron, who is here with me today, also co-leads that, and I'll let her introduce herself.
Hi, everyone. My name is Aleece Caron, and I'm an associate professor of medicine at the Metro Health System and Case Western Reserve University, and I'm also the co-director of education for our Population Health Research Institute at the Metro Health System.
So first, we really wanted to briefly describe our Heart Healthy Ohio initiative. The Heart Healthy Ohio initiative is really a statewide cardiovascular health collaborative. It's funded by the Agency for Healthcare Research and Quality. And the leadership for our initiative really includes the colleges of medicine at 3 universities and their affiliated hospital systems. So Case Western Reserve University and the affiliated Metro Health System, the University of Cincinnati, and the Ohio State University. And we're working in collaboration with 3 regional health improvement collaboratives. The Better Health Partnership, which is in Northeast Ohio, Health Impact Ohio, which is in the middle part of Ohio in Columbus, and the Health Collaborative, which is in the southern part of Ohio. And they really assist us in developing the external quality improvement support infrastructure across the state for our quality improvement work. And we also partner with numerous stakeholders, including professional organizations, community organizations, insurers, and state government agencies as part of our Stakeholder Engagement Committee, including the Ohio Academy of Family Physicians, who is hosting this discussion today.
So we've also been working together with 50 primary care practices across the state since May of 2022 to improve blood pressure and smoking cessation, as well as reduce disparities in cardiovascular disease. We're delighted to be here today to share what has been happening over the past year and what is coming up in the future that we're really excited about. So, Dr. Bolen, what do you see as the biggest accomplishments, or what are the biggest accomplishments for the Heart Healthy Ohio initiative over this past year?
Well, I think our biggest accomplishment in the past year is really working and finishing work with our co-design sites who are piloting our quality improvement efforts around blood pressure control and smoking cessation. And they've made really important improvements in blood pressure control rates by about 5 to 10% in the last year. And they're continuing to do work to continue to improve their efforts. So we're really excited about that. And the other really big accomplishment was really working and recruiting 50 primary care practices across the state to work with us on larger quality improvement interventions around blood pressure control and smoking cessation. So we're starting to see some improvements already in blood pressure control and smoking cessation assessment at those sites. And I'm really looking forward to seeing what happens over the next year as we work with those sites together. So thank you for asking about the accomplishments, Dr. Caron, but I wanted to ask you, as our quality improvement lead, in addition to helping us lead the collaborative, how have you been able to work with practices on their quality improvement efforts to ensure success?
Great questions. We've done a bunch of different things. So initially we had a virtual half-day kickoff event with the practices and all of our stakeholders, or a lot of our stakeholders, to share the evidence-based best practices and project activities in the project timeline. Following the kickoff, practices were assigned to coaches, where the coaches really helped them by meeting with their core quality improvement team at the practice site to assist with what we in quality improvement refer to as a plan, do, study, act cycle, which really helps guide quality improvement activities. In addition, we hold quarterly webinars for all the practices and the core teams to continue to share, and we continue to share clinical content as well as QI content. And we have peer-to-peer learning where the early improvers can share what they are doing, and other practices who may be struggling to get started or aren't seeing the gains that the early improvers are can ask about how they're doing those sorts of things and address any challenges that they may be having.
Yeah, that's great. All those multiple touch points really allows the practice to learn from each other, but then also from the really strong quality improvement coaches. So I love that interaction piece, which I know is so important to having that success.
It's also a lot of fun.
Yeah, there you go. So what have been some of the biggest challenges that you face?
Like any large scale project, we're going to have some challenges, and I'm just going to highlight a few. Sharing electronic health record data has taken longer than we really anticipated, but now we have all the sites, except for one, sharing data so that the sites can use the data for continuous quality improvement efforts, including setting disparities aims. And this data is available to them on our website, and they can log in and look at their data. Secondly, as a lot of people are experiencing, the practices are dealing with staffing shortages and turnover. And this has made it challenging for some of the practices to participate as much as they would like. We've had some challenges with engagement, and some practices had trouble participating at all. The recruitment of 50 sites was quite challenging because of this. And, we started the project during COVID. So there were challenges that we faced because of staffing shortages and things like that. And then third, really determining how best to engage with payers and reduce barriers to care within a short project timeline, because policy changes within these plans can often take time. And just like the practices, payers experience some turnover. And so we've had to, re-engage with different people in different plans.
Right. And, this is a common problem with staff shortages and turnover. How do you handle that in quality improvement so that you can continue to make change and not have that really take over everything?
Great question. And this is an ongoing challenge. And we have to understand, as leaders of this project, and even the coaches need to understand that this project may not be the priority for the practices like it is for us. So we have to be patient and understand that they've got to work through some of these challenges and meet them where they are. Nagging them for data or participation isn't really an effective method. So just being patient and asking if there's anything we can do to help support the practices in any of the challenges that they're facing. That's really been my strategy of doing quality improvement my entire career, that you really just have to meet the practices where they are and understand what their needs are.
Great. Yeah, that's so important. What one thing that I think we have is a lot of both patient and other stakeholders engaged in our efforts. So how have you included both patients and other stakeholders in this effort, and what have they been able to bring to the collaborative?
Well, initially we included patients in our partner. We included obviously patients and all the partners in the work that we've already discussed. In our co-design phase, which we did in the first year, we started in the first year, we really wanted to include patients as part of that. So they were actually involved in our co-design activities. And it's really a best practice to include patients on your quality improvement teams, so you can get their feedback and input. That doesn't mean that they have to attend every meeting, but just so that they're involved, so that they understand what's going on and can give feedback about whether or not the solution or the intervention is feasible for them and makes sense to them and things like that. We've also engaged with payers and the Ohio Department of Medicaid across the state routinely to meet on 4 priority areas. One is making ordering of home blood pressure monitoring easier. The second is enhancing medication taking strategies. The third is ensuring coverage and access to smoking cessation resources. And finally, addressing health-related social needs. We also hold a stakeholder meeting twice a year so that the stakeholders can give us feedback and help us align with other statewide agencies, such as the Ohio Association of Community Health Centers, OAFP, who's hosting this event for us, and other professional organizations, also community organizations like the American Heart Association, the Ohio Department of Health, lots of employers, and others. These organizations really provide advice for us, but also help disseminate these evidence-based cardiovascular best practices to primary care teams across the state, and really help us disseminate best practices from our quality improvement project so other practices can think about how they might uptake those efforts.
Great. Well, thank you so much for sharing that with us today.
Dr. Bolen, I'd like to ask you one question after, I've kind of talked throughout this entire time. But as the co-PI on this project, looking forward, what do you see as ahead for Heart Healthy Ohio in the coming year?
Yeah, I think we're really excited to see our 50 practices continuing to work on making quality improvement efforts around blood pressure and smoking cessation over the next year, and really evaluate how that went and what we can do to improve in the future. We're also working with Ohio Department of Medicaid, which just funded the colleges of medicine across the state of Ohio to develop regional quality improvement infrastructure to really collaborate together. And I think that will strengthen what the QI or quality improvement infrastructure that we've already built as part of our statewide effort. It'll really build on that and enhance that. And it'll allow us to sustain the quality improvement efforts within primary care practices into the future. So I'm really looking forward to both of those things. So with that, we'll really end our discussion today of in sharing what we're doing with our Heart Healthy Ohio initiative. I want to thank you, Dr. Caron, for joining with me today in this discussion. I want to thank the Ohio Academy of Family Physicians for providing a platform to have us share our activities and future plans with all of you today. And we really encourage anyone interested in our materials and resources to visit our Heart Healthy Ohio Initiative website at www.hearthealthyohio.org. Thank you.